Good morning, and welcome to the National Academies of Science, Engineering, and Medicine's Health and Medicine Division's Dissemination Workshop on Strategies to Improve Cardiac Arrest Survival. I'm Tom Aufderheide. I'm the chair of this Planning Committee workshop and professor of emergency medicine at the Medical College of Wisconsin. I want to remind everyone that this is being webcast, and we welcome those of you who are joining us remotely. It is unknown how many people suffer cardiac arrest each year in the United States. Conservative estimates indicate approximately 600,000 people suffer out-of-hospital or in-hospital cardiac arrest each year, 12,500 of which are children. Cardiac arrest survival rates remain unacceptably low. An out-of-hospital average of approximately 7%, and overall cardiac arrest represents the third leading cause of death in the United States. The number of productive life years lost because of cardiac arrest death and disability represent an enormous public health burden. Cardiac arrest is not necessarily the last event in a long life. Cardiac arrest strikes people of all ages, races, and gender, often in the prime of life, in seemingly healthy individuals without warning. Effective and scientifically proven treatments for cardiac arrest are widely available, including immediate 911 access, bystander CPR, early defibrillation, high-performance EMS resuscitation practice, and optimized hospital-based care, characterized by this chain of survival. These effective and scientifically proven treatments could significantly reduce death and disability if they were more efficiently and comprehensively implemented. Benchmark communities with a 60% witnessed VF cardiac arrest survival rate provide us with evidence that increased cardiac arrest survival and function are possible. The failure of the American public, our EMS systems, and our hospital-based healthcare providers to efficiently, consistently, and routinely provide a strong, coordinated system of response to cardiac arrest in this country, and the potential to significantly improve public health by addressing these issues nationally, provided the motivation for the IOM report titled Strategies to Improve Cardiac Arrest Survival, A Time to Act. This report included 8 recommendations, which are listed behind your agenda and are the reason for this workshop. Although the chain of survival is useful to guide operational decisions within individual systems, the IOM committee felt a different and unifying framework was needed to identify the overarching goals for the resuscitation field nationally, represented by this figure. One goal, improved survival and outcome from cardiac arrest, provides the roof. The foundation and pillars are part of an integral, comprehensive, system-level response that is necessary to revitalize the resuscitation field and improve population health. The report emphasized the following strategies in their recommendations, represented by the Foundation's steps: establish a national registry of cardiac arrest, educate and train the public in EMS system activation, CPR, and use of AEDs. Enhance performance of EMS systems, emphasizing dispatcher-assisted CPR and high-performance CPR. develop strategies to improve systems of care within hospital settings, expand basic clinical, translational, and health services research in cardiac arrest resuscitation, and promote innovative technologies and treatments, and create a national cardiac arrest collaborative to unify the field, identify common goals, and improve survival. These recommendation steps form the foundation to support an effective cardiac arrest response from the 5 pillars that directly or indirectly affect patient outcome: the public, EMS systems, hospitals, researchers, and professional organizations. Leadership, along with transparency and accountability, serve as the cornerstones that establish the position and direction of the entire structure. Consistent with the original title of the report, now is the time to act. The goal of this workshop is to bring together multiple stakeholders to create a united front and explore approaches to implementing the report recommendations. These recommendations are meant to benefit us all, including, and most importantly, individuals who experience a cardiac arrest. Accordingly, this workshop will feature encouraging data collection and dissemination, promoting public education and training, improving delivery of high-quality resuscitation and post-arrest care, enhancing the impact of cardiac arrest research and therapies, and strengthening stakeholder collaboration. As a reminder, this is a workshop, so there will be no findings, no conclusions, and no recommendations that result from our work over the next 2 days. Instead, our job is to identify barriers and provide options to consider when implementing specific IOM recommendations. Publication of workshop results will include these identified barriers and suggested options. I'd like to thank our workshop sponsors. They include the American Heart Association, American Red Cross, the Centers for Disease Control and Prevention, the Medtronic Foundation, Physio-Control, Sudden Cardiac Arrest Foundation, Zoll Medical Corporation, and the Asmund S. Lerdahl Foundation. We thank them for their generosity that made this workshop possible. I'd also like to thank the Health and Medicine Division staff and the many others who are joining us today who have been the driving force behind this workshop. Also, thank you to my fellow planning committee members. You will be seeing these people in your breakout sessions and during panel discussions. Thanks to each of you for the preparations and the time you have invested to make this workshop possible. I'd like to briefly review some workshop logistics. The 2-day agenda is packed and will require us to strictly adhere to the indicated times. The workshop is divided into 4 sessions, each of which include first a panel presentation, followed by breakout group discussions. We're going to be hearing from a number of exciting speakers during the next 2 days, some of them from the resuscitation community. Others from outside the resuscitation community had no idea why we invited them to speak. Nonetheless, we convinced them that their valuable experiences outside resuscitation would serve as good examples from which those experts in our audience could extrapolate. And we especially thank them for being here today. To keep the workshop streamlined, speaker introductions will be brief. More complete bios of these accomplished individuals are available in your meeting materials. After each presentation, the moderator will engage the panelists in discussion and take a few questions from the audience. Audience members, please use the microphones in the middle of the aisles. We will then move to breakout sessions where the bulk of the work will occur. Before the first breakout groups today and tomorrow, you will have 30 minutes to collect a lunch from the Great Hall just outside these doors and find your breakout rooms. In the afternoon, you can grab a snack and head to your afternoon breakouts. Please note that no food or drinks are allowed in this auditorium. Your assigned breakout rooms are listed in your meeting materials based on your indicated preferences. Please go where you are assigned because some of the rooms have very limited capacity. Time is tight, so please be focused in your comments. After our last presentation today at 5:45, there will be a reception held in the Great Hall, again just outside these doors, and we urge all of you to participate in the reception, network, and continue to develop your valuable contributions. We look forward to a productive workshop, the formation of new alliances and new collaborations, and the beginning of a structural framework upon which to base a successful action plan to realize the IOM report recommendations and significantly improve cardiac arrest survival in this nation. Thank you.